Good morning, Smarter News. Today, we're going to start off with a story that's completely different, that you may not hear anywhere else, but is a reminder about why history matters and why historical context can really give us some extra depth to headlines. So, I'm going to do the best I can this morning. All the kids are awake. If you listen closely, you can hear PBS Kids in the background, as my 2-year-old is right there. So let's see how well we do. Sometimes this does feel like an Olympic sport. And before we knew names like Caleb and Ryan, before we knew names like Lydia, have you seen this photo of Lydia returning home to Alaska? How beautiful is this? Before we had these famous swimmers, we had someone by the name of Duke. This is Duke. I'm going to try to do the best pronunciation. Kahanamoku, but everyone calls him the Duke. He's a famous swimmer, famous surfer from Hawaii, and in 1911, on this day, he broke the world record for the 100-meter swim. And really that started to catapult him into the public eye. He went on to win several Olympic gold medals, but he was really into surfing as well. And some believe without him, the sport of swimming and surfing would not be what it is today. So we have Duke to thank for that. Now, during our Olympics, we saw surfing as one of the new sports that were added. And really all of this could be kind of followed back to Duke, where in 1911 on this day, he did something incredible. And he became one of those superstar athletes that now we all kind of recognize. I thought this was funny, by the way. I know some of the photos of the swimmers that you can kind of look at them like, wow, but you can see they really haven't changed in 100 years. So again, history matters. What we're seeing now, what we think is just normal, these big sports that we watch all the time, the athletes that we think are the cool athletes. Well, this has been an evolution going back to those that were trailblazers, and Duke, the Duke, was one of them. So I wanted to share that with you today. It's funny how things happen in your reporting. As I was doing a live with Dr. Rutland, I pulled up a picture of what is a coronavirus. And this is just a stock photo, but it led me to a study from the University of Arizona, where researchers there found evidence of a coronavirus epidemic more than 20,000 years ago. What they're saying is that they were able to look through our genetics. They were able to find what they believe is evidence of a coronavirus epidemic that could have altered somewhat the way that we have evolved, at least dating back to a certain part of the world. This is just a reminder that we have lived with coronaviruses for a long time. And in the last several decades, we've seen a few of them, including the first SARS outbreak, or MERS, for example. So really, as we're starting to talk about the new coronavirus in this stage, we're talking about it in a way that is one that we're going to have to sustain and live with for a long time. And that's disappointing somewhat, isn't it? Because you want to get to the end of the pandemic, but the reality is it's a reminder. Pandemic refers to a disease that we're seeing a lot of places. It doesn't necessarily refer to a deadly disease, and we don't want the new coronavirus to cause a deadly version of COVID-19, the disease that is caused by the virus. One of the big headlines that you've likely seen this week has a lot to do with children and seeing higher cases of children with COVID-19. But I want to give you some context, and history matters here too, because some of these headlines are scary. So on smarternews.com, you're going to see a report that we worked on, kind of like what is the state of children in COVID right now. The big thing to know is that data is really difficult to glean, and it's hard for a couple different reasons. But I have a good example in my area in Austin. When you see a headline, why you have to go a little bit deeper. So one of the big headlines is that children have tripled in the ER here. But if you look at the actual numbers, in June, the number of children in the hospital with COVID-19 was 11. In July, that number tripled to 34. But notice how I said with. with COVID-19. What you should know is that dating back to the beginning of this pandemic, there has been concerns about data and whether or not we're categorizing COVID patients the correct way. So is someone coming into the hospital to get treated for a broken arm because of a skateboarding accident, and you have a lot more infection in the area, and that child ends up testing positive for COVID-19? Is that part of the data? How is that worked in? Now, if you talk to ER doctors, ICU doctors, they say hands down across the country, they're seeing more young people. And that can be true. Both things can be true. They can be seeing more young people, but the numbers, when you give it context, are still historically low. What we're going to see and watch for is what happens over the next 2 months. Do those go from low to something that's more concerning? But I think that's really helpful. Also, historically, summers are very busy times in the ER for all sorts of reasons. So we don't want to forget that. Just so you know what I'm talking about with or for COVID, sometimes that can be sort of a controversial term. But here's a quote from someone that has a lot to say on the topic. It's really important to distinguish between children who are hospitalized with asymptomatic SARS-CoV-2 infections and those hospitalized for COVID-19 disease. Our goal is to make sure we have accurate data on how sick children are getting. If we rely on hospitals' positive test results, we are inflating by about twofold the actual risk of hospitalization from the disease in kids. That's from Associate Chief of Research, Lucille Packard Children's Hospital, Stanford, Dr. Alan Schroeder. So this is someone that can speak to this topic. This is something that you should know that is at least a concern. And data historically has been an issue when it comes to this particular pandemic. We hope to get better at it, but this is the issue right now. Real quick here, yesterday we were talking about Governor Cuomo in New York and the allegations against him. And less than 24 hours after that report, Governor Cuomo announced his resignation effective in 2 weeks. What is going to happen is a woman by the name of, it's Lieutenant Governor Hochul. She is going to assume the position of governor in about 2 weeks. This is historic because she is the first female governor to serve in New York State. Now, some context for this. Less than 100 years ago, we had our first female governor in America, in the state of Wyoming. Sorry, that picture's a little bit off. This is Nellie Ross. And she came to the governorship in a unique way as well. Governor Ross took over her position after her husband passed away. And the Democrat Party at the time approached her and said, would you like to run? And she became, in a special election, she became the governor in Wyoming. So untraditional paths, less than 100 years apart, and you're seeing history being made. 2022 is the next governor race in the state of New York. And that's going to be a real race to watch. High profile state, lots of different Democrats vying for the position, which has gone to Democrats in recent years. Tomorrow we have a big interview that's really focused on natural immunity from a Johns Hopkins public health policy expert and physician, Dr. Marty McCary. Been waiting to share this with you. It's going to be yet another perspective on the pandemic, and I'm really excited to hear what you think about that. So a lot coming up, all of this and more on smarternews.com, and hope you guys have a great day. Thanks for rolling with us during these crazy times.